Good morning, everyone. A very warm welcome to everyone on the dais and off the dais. I'll introduce myself. I'm Dr. Sunil Mangalam. I finished my conservative and endodontics in Savita Dental College in year 2003. See, when I finished my endo, there was a situation in integrated AP where an endodontist was not called as a consultant. There was very much hype of an orthodontist, oral surgeon, but they've almost overlooked an endodontist. In endodontist, they have never treated him as a consultant. We are the few endodontists for the first time who came out and we started consultation. And there are some dentists like Swami sir who encouraged us that during that time an endo can also be called as a consultant. I remember we used to do almost around 20-25 root canals in a day, a single day. So that's how I started my career as an endodontist, and I was very happy. In fact, now everyone, in fact, I see each and every clinic they call endodontist for consultations. Putting aside my things, why do we need these kind of academies? What is the importance of academy? See, after finishing my PG, I've worked in so many colleges. I've seen there are lack of patients, or most of the patients have taken away by PGs. So these BDS doctors have seen they are coming out of the college with degree but without treating any patients. I'm very sorry to say that. I mean, maybe this is not the podium to share these all things, but this is a fact. I've seen many colleges in integrated AP and in Telangana, there is not much of OP. In Savita, it was different. In Savita, when we were allotted a case, it was almost 2 months prior we had to give an appointment to that patient. But when I've seen in the college of integrated AP or Telangana, I've seen most of the college doesn't have so much of OP. Even if there is any OP, most of the PGs takes up those patients. So these academies help the enthusiastic dentists who comes out and want to learn something and to practice something. I really appreciate the people who have started these academics and really teaching them. And I've seen Dr. Anil doing a very good job in that because I'm the product of the same company. I'm an endodontist, but I have done my implantology from same academy in year 2018. So what do we get to learn in these academies? See, I'll tell you my example. I'm very happy endodontist. I was a consultant. I have my 2 practices. It's going good. But but one fine day I thought life was simple. I mean, no hiccups. It was like a safe drive. So I was happy with my little car also. But suddenly one day I've seen my junior passing by and he was in a BMW. So that raised my eyebrows. What is this guy doing now? Then I told him, what is you up to? What is this you are doing now? He told, Anna, please stop digging the canals now. You have to dig little more. Please start into implantology. That's where the money is. That's where the life is. So I thought, it's a time to upgrade yourself. So it's a constant practice. You are not master of anything. Academies are something which will help you to constantly master yourselves. So these academies will really help you. And when 2018 I have joined implantology, now it's like an implant for a day for me. Almost I do 30 to 50 implants in a month in all my 3 clinics. So that's how I mean, even if you have done something here, you upgrade yourself. If you have finished your endo, you have done your prosto, then upgrade to implants, upgrade to lasers. It's a constant thing. You don't stop yourselves there. So I want to tell all the younger dentists who have finished their academic thing, so please try to upgrade yourself. And about the mentor. Coming to the mentor, he's a very cool chap, a 100% charged battery sort of person. You see him in the morning, you see him in the night, every time he's like 100% charged battery. He is very helpful. You all must have come through him. He's a very good guy and he's really helpful to all of us. And how do we practice after going from here? So the younger dentist who has finished your academic thing, how do you practice from now? I'll tell you the simple rule. I have 8 to 10 doctors working with me. I tell them if there is an extraction, try to do root canal in that case. try to do extraction in that case. So that will really help you out. I mean, see, if you are starting up your own practice, well and fine. Even if you are working somewhere, what you can do is, if there is an extraction case, you can ask your doctor. You can ask him that, sir, I want to do root canal in that. So there is nothing you to lose there. I mean, even nothing for a patient to lose there. You can do a crown cutting. So that's how you can improve, constantly improve yourself. This is the way you have to keep it in practice. I mean, you have done here, and it's not that everything is over. Whatever you have learned in the academy, you have to go back to your practice and you have to put it into practice. Coming to the future of dentistry. See, I've seen most of the people, I mean, they are very pessimistic about dentistry. Please don't be like that. You know what's the per capita income of India? It's only $2,500. Only 1% population is affordable to go to dentist. India is definitely growing. India is in a path of growing. We will have definitely better future. Don't worry about that. Even if 1% more is included, I am very sure that every dentist will have a lot of work to do. And when these insurance companies come into play, we definitely have very good opportunity in dentistry. Please try to be optimistic about dentistry. And coming to ethics in dentistry, please don't compromise on the ethics in your practice. If it is a class 2, it has to be class 2. It will never go for a root canal. I've seen many practitioners, a root canal thing is going for an implant and a class 1 is going for root canal. Please don't do that. Please don't do that. Stick on to your ethics. Your practice will maybe initial hiccups will be there, but when you stick on to your ethics, when you gain the confidence of your patients, it's going to be definitely different ball game altogether. So take it as my word. Always stick on to your ethics. Don't compromise on your ethics. So coming to the conclusion, see, I'll tell you, practice is not about we are not like a medical practitioners. 3 new walk-in patients, you will have a very good practice. 100 OP in a month, you will have very good practice. Dentistry is all about, I mean, we doesn't need our halls to be filled up with patients. 2 or 3 new OP, we are going to have very good practice. We always have to compare ourselves with Ferrari cars. You know how many cars Ferrari produce in a year? It makes 13,000 cars only per year. But whereas Toyota makes more than 13,000 in a day. But Ferrari's price is 25 times more than Toyota. So always be like a Ferrari. And one last thing which I want to conclude is, always focus when you do it on patients. That's a truck driver has one thing always in mind. Nazar hati to durgatna gati. So you have to always remember, when it's your patient, you have to concentrate on your patient. I mean fully, thoroughly. It's root canal, it's not easy. I think these are the few things which I want to put into the young dentists. If this helps you, well and good. Thank you.